Shawn is not here in studio with us. She's actually outside undergoing a mammogram right now in the mobile mammogram truck that OhioHealth has set up again outside for us. Let's check in with Shawn right now and see exactly what part of the process she's in. Good morning, Shawn.
Hi, everybody. I'm in the mobile mammography unit for OhioHealth right now. Maybe you saw on Facebook Live. We are doing a live mammogram. We did it last year, and the results were wonderful. So we're hoping for the same thing this year. Rebecca's back. She's the girl who knows my breasts like no other now. And Keely as well is going to help us with imaging. And we've got already a few of the pictures put away. We've gotten those taken care of. Dr.Lauren Miller is going to be in studio and telling us what she's going to be looking for when it comes to breast imaging. She read my screen, what do you call them, films? Whatever. Images. She read those last year. So tell people who've never seen this machine work, what does it do? And the pressure, how does that work?
So this is the mammography unit. Of course, it has compression that comes down, so we usually can control it with our feet down here. Just bring it down to where it touches the breast. We don't want to cause any pain or anything. And then you can just fine-tune the amount of pressure that you have. We always tell ladies it should not be painful. We need to make sure that the skin in the breast is firm and taut, but it should not be painful. So if it is, we ask ladies, please let us know. We can make different arrangements if you're positioned just improperly, something's pinching, we can always just adjust it. And we want to make it as comfortable for ladies as we can so they continue to get it done and get screened.
And what are the obstacles for people?
If people have like shoulder issues or something, some of the images, the side pictures that we did, you can't stretch as far. We need to really get back into the pec muscle and the lymph nodes in the armpit or the axilla. So sometimes that can be a limitation, just physical limitations that way.
And you know, I've never found it to be painful. And I wonder why people do get so nervous.
I think it's just the old tales. The old machines weren't as nice as these, and some ladies just, they keep reverting back to that in their mind that, oh my goodness, that was so painful. And then they tell future generations, like, mammograms hurt.
Yeah, they just keep, it's an old folktale thing.
Yes.
Huh? Okay, we have 2 more images correct to do. We're going to do them live very strategically. Kelly's behind the camera. I trust her implicitly. And all you guys in the control room, stop it. Okay, here we go. So these are straight on now?
Straight on. We'll start on the right side.
On the right side?
So you can kind of keep the sleeve on for this one. We'll just go a little bit off the shoulder there.
All right.
I'm going to turn you towards the machine a little bit.
And we should mention, I mean, this is radiology.
Yes.
So Kelly is wearing a very heavy bib right now to protect herself from x-rays.
Lead aprons, and Rebecca's back behind. Our control panel has a lead window there that we stand behind, so we are protected as well.
But it's low dose, so I don't have to be concerned.
Low dose, and it's just typically once a year for you, so not anything.
Do men do this?
If men are having an issue, we'll do them, not screening, that we do them diagnostic. Usually we work out of the main cancer center.
Okay.
So they'll come in, and we do see a lot of like gynecomastia, usually in older men from medications.
Older men, okay.
We just need you to hold really
still.
Here
we go.
And then hold your breath. Perfect, you can breathe.
Okay.
We'll get you all covered up.
I'm breathing.
Not too bad.
One more. They have to check and make sure it's not blurry. Are they lovely? Kelly, you stay on this side.
Perfect.
Nobody needs to see that.
So we'll do the same thing on the left side. And yeah, we just check for motion. We have you hold your breath just since the breast is close to the chest. You can get kind of that chest rise. I'm going to scoot you towards me a little bit. A lot of ladies are like, why do I have to hold my breath for it?
Yeah.
But just so it's not blurry.
You guys are so gentle. When it is happening, just so people know, I'm not sure if my microphone is going to pick this up, but it is, it's pressure. It's not pain. If you were to squeeze somebody's, like their arm really hard, you know, you would feel that pressure, but it's not hurting me at all. I would imagine if you're smaller breasted is a little more difficult.
It does seem to be, just because they don't have as much to work with, so sometimes we can actually kind of rub the compression paddle on their bone a little bit, so They do get a little bit more discomfort from it, but still most of them have no problem with it.
Hold real still and hold your breath again. Perfect. Breathe.
All right.
That's good.
And just like that, I am done. And what did that take? 20 minutes, maybe?
At most,
For all of it, maybe.
15? Yeah.
Registration to the end.
And I know you guys will take these units to companies. In fact, ours is going to be here today. We have a lot of women signed up to get their mammograms. It's such a nice thing for a company to do for the women employees you have. You know, certainly everybody's got to be mindful of getting this done every year after the age of
40.
After the age of 40. All right, I'm done. I'm going back in the studio and I'm going to talk to Dr. Lauren Miller, who looked at my images last year, and ask her what she's looking for this year too. Send good wishes and prayers. Hopefully everything's going to work out. I have a good feeling. So we'll send it back into you guys. Absolutely correct. It'll take a couple hours before I can get those scans read by Dr. Miller. She read my scans last year. Does that help when you already have seen somebody's breasts?
Well, absolutely. One of the major things that we look at when we're looking at a mammogram is somebody's prior images. So
Right.
everybody has different tissue patterns, different densities. So we always look at multiple prior mammograms to get a sense for what somebody's general tissue pattern is and to notice for any changes.
You know, I hear from a lot of women and they're told that they have breast density. I think we might have images of that. Now, these are not mine, but it is an example of what a dense breast would look like.
So this actually goes through all the different types of breast density throughout the spectrum of breast density of a patient's particular breast. So on the left is the fatty breast. So that's a breast that is predominantly fatty breast tissue, not that much dense tissue. We can really see through the tissue. And then you follow the spectrum through scattered fibroglandular tissue, heterogeneously dense tissue, and then extremely dense breast tissue on my right, where if masses or abnormalities were to be put in that breast, they have more chance of being covered up. So we do 3D tomosynthesis imaging a lot of patients now that can kind of see through some of that density, but it is one of the first things we look at is what is the patient's breast density and has that changed from priors?
So is that an indicator if breast density changes?
So breast density can change with hormonal changes,
Okay.
both intrinsic and extrinsic hormonal changes. Weight changes can really cause a change in density as well.
Well, I want to see, and I'm sure many people are curious, what does a cancerous breast look like? I think we have those images. Those should be behind us here in a minute. So if you could point to those, that would
breast
help.
cancer can actually present in many different ways. So we look at masses. They can both be circumscribed masses or more regularly irregular or speculated masses. The mammogram on the left part of the screen shows that oval circumscribed mass. Now, from a mammogram itself, I can't tell if that is something benign or non-cancerous, like a cyst or a benign mass called a fibroadenoma. You can also get cancers that show up like that. On the right side, there is some increased density to that breast, and I would probably compare to other prior studies if that's a change, because that can be an indicator of a breast cancer. But we also look for microcalcifications that can show up in early cancerous cells called ductal carcinoma in situ or
and
DCIS.
people usually feel those, don't they?
DCIS is typically not felt. That's microscopic, typically disease.
Okay.
Yeah.
But if you feel something that's hard,
Yes.
Is that an indicator?
It can be worrisome. We always say if you notice any change to your breast tissue or change to your own regular exam or how your breasts normally feel or normally look, so get it checked out by your doctor. Firm masses can be abnormal. Sometimes people have firm, dense breast tissue, so we definitely want to evaluate it more.
And I'm sure you want more and more women to get this done early.
So we are very strong about recommending annual screening mammography starting at age 40 and then continuing every single year after that. That's for the average risk patient. If patients are of higher risk, they may require earlier screening starting earlier or additional testing with MRI.
Okay, well, I feel I'm in good hands. I literally was in good hands today.
We have some amazing technologists. They are really excellent.
They're phenomenal.
We're so lucky to work with them.
She'll be reading my films yet again. I want to thank everybody from OhioHealth who was here to make this happen this morning. They're so calm about it all. And I really do feel like for all of you out there who have any apprehension whatsoever, you shouldn't have
Get your mammogram.
Yes, absolutely.
Very important.
Dr.
Saves
Miller,
lives.
thank you so much.
Thank
Good
you,
to
Shawn.
see you. And we'll share those results later.